I've always been interested in the way we deliver cancer services. When I was a research fellow at the Princess Margaret in Toronto, we had very long waiting lists, and everybody was concerned about what that meant, but nobody really knew what would the effects be and how could we avoid this situation for cancer patients in the future. So my research has been about the delivery of cancer services. We've created an extensive evidence-based model of the demand for cancer services, mostly for radiation treatment, but now also for chemotherapy, and also those benefits that we get from treating cancer. Now that might sound a little obvious, but in fact it's quite difficult to tease all this out. And this work has been the basis of the justifications for new cancer services around Australia, something like $500 million worth of new services in regional Australia, as well as investments in large infrastructure like the Peter MacCallum and new cancer centres in Darwin and in Tasmania. Our work has been taken up internationally. The European Union uses it to estimate the demand for cancer services in all of the 28 countries that are part of the cooperative group. And most recently I've been working on global estimates, so estimates for each country of the demand and benefits of cancer treatments and what would be the investment case. We estimate you would save something like $220 billion over 20 years if everybody got access to the type of cancer treatment that they needed. This is in terms of increased productivity and reduced caring costs. I'd like to thank Research Australia for this award. I think it's wonderful that Research Australia recognises the value of health services research to patients and to the Australian community. I'd particularly like to thank all my collaborators. Nobody does anything in research, and particularly health services research, without a wide range of collaborators. I have very many people that I've worked with closely over a long time, and they are really the people who deserve recognition at least as much as I do. So thank you again.